Your child just asked you for the third time today if you still love them. Or maybe they're suddenly clinging to you when they used to be independent. Perhaps they're acting out aggressively at school or melting down over the smallest things. You're confused because nothing major has changed in your family. But here's what you might not realize. Your child is sending you urgent distress signals that their sense of security has been shaken. And if you miss these signs, the consequences can follow them into adulthood. Childhood insecurity isn't always obvious. It doesn't always look like a child who's withdrawn or fearful. Sometimes it shows up as aggression, perfectionism, or even overachievement. And here's the frightening truth that most parents don't understand. Insecurity formed in childhood becomes the blueprint for adult anxiety, relationship problems, and chronic self-doubt. The child who feels insecure today becomes the adult who sabotages relationships, struggles with imposter syndrome, or can't make decisions without constant reassurance. But here's the good news. Insecurity isn't permanent. When you learn to recognize the signs early and respond appropriately, you can rebuild your child's sense of safety and security before it solidifies into lifelong patterns. Research from attachment theory shows that children are incredibly resilient when parents make repairs and create consistent emotional safety, even if things haven't been perfect up to this point. Today, I'm going to reveal the 3 most critical signs that your child is struggling with insecurity, why each sign matters, and most importantly, exactly what you need to do to help your child feel safe, confident, and secure again. Some of these signs will surprise you because they look like behavior problems or developmental phases, but they're actually desperate cries for connection and reassurance. If you're committed to raising emotionally secure children who grow into confident adults with healthy relationships and strong self-esteem, make sure to hit that subscribe button and turn on notifications. We share evidence-based parenting insights every week that address the real issues beneath behavioral symptoms, helping you build genuine connection and security with your children. Before we dive into the specific signs, let's understand what childhood security actually means. Secure children have an internal working model that tells them, I am safe, I am loved, my needs matter, the adults in my life are reliable, and the world is generally predictable. This doesn't mean their life is perfect or they never experience challenges. It means they have a foundation of trust that allows them to explore, take risks, and recover from setbacks. Insecure children, on the other hand, have learned through experience that they can't count on consistent care, that their needs may not be met, that love might be conditional, or that the world is unpredictable and threatening. This doesn't require abuse or neglect. Even well-meaning parents can accidentally create insecurity through inconsistency, emotional unavailability, or misunderstanding their child's needs. The first critical sign of childhood insecurity is excessive reassurance-seeking and clingy behavior. This shows up differently at different ages, but the pattern is the same. Your child constantly needs validation that you love them, that everything will be okay, or that they're doing things correctly. They might ask repeatedly if you're proud of them, if you're angry at them, or if you still love them even after you've answered multiple times. In younger children, this often manifests as physical clinginess. The 5-year-old who suddenly can't sleep in their own bed anymore, the 7-year-old who panics when you drop them at school, or the toddler who screams when you leave the room even to use the bathroom. In older children and teens, it might look like constant texting when you're apart, seeking approval for every decision, or needing repeated confirmation that they're not in trouble. Here's why this matters. Children who feel secure have an internalized sense of their parents' love and presence. They can carry that security with them even when apart. Insecure children haven't developed this internal working model, so they need constant external confirmation. They're essentially asking, am I still safe? Do you still love me? Can I still trust you? Every single time you're out of sight or they face uncertainty. This behavior often frustrates parents who interpret it as manipulation, attention-seeking, or developmental regression, but it's actually a desperate attempt to establish safety and predictability. The child's nervous system is in a state of threat, constantly scanning for signs of danger or abandonment. Your frustration or irritation in response to their seeking only confirms their fear that they can't count on you, creating a vicious cycle. So what do you do about it? First, understand that you can't logic your child out of this pattern. Saying, "I already told you I love you," or "stop being so needy," doesn't address the underlying insecurity. Instead, you need to flood them with consistent reassurance without judgment about the asking. When your child asks for the 5th time if you're mad at them, respond warmly every single time. "No, I'm not mad at you. I love you always. Nothing you could do would make me stop loving you." Second, increase physical affection and connection without waiting for them to ask. Secure children receive enough unprompted affection and attention that they don't need to constantly seek it. Insecure children are operating from a deficit, so they're always trying to fill that empty tank. You fill it by initiating hugs, spending one-on-one time, giving compliments, and showing interest in their world consistently throughout the day. Third, create predictable routines and clear communication about separations. Insecure children are terrified of the unknown. When you have to leave, tell them exactly when you'll be back in terms they understand. For young children, that might be, "I'll be back right after your nap." For older children, "I'll be home at 5:30 and we'll make dinner together." Then be absolutely reliable about following through. Fourth, address any recent changes or stressors that might have triggered the insecurity. Has there been a new sibling, a move, a change in family dynamics, increased parental stress, or even something subtle like a shift in your work schedule? Children's security is shaken by changes we might not think are significant. Acknowledge these changes directly. "I know things have felt different since the baby came. That must be confusing, but my love for you hasn't changed at all." The second critical sign of childhood insecurity is extreme perfectionism, or fear of failure. This one surprises many parents because perfectionism is often praised in our achievement-oriented culture. But there's a crucial difference between healthy striving and anxious perfectionism driven by insecurity. Secure children try hard because they enjoy mastery and growth. Insecure children try to be perfect because they believe their worth and your love depend on their performance. Watch for these patterns. Your child has a meltdown over a single mistake, refuses to try new things because they might not be immediately good at them, cheats or lies to avoid admitting failure, or quits activities the moment they become challenging. They might erase and rewrite homework until the paper tears, or refuse to turn in work they believe isn't perfect. They might practice a skill obsessively, but melt down if they can't master it instantly. In younger children, this might look like extreme frustration during learning tasks, hitting themselves when they make mistakes, or saying things like, "I'm stupid," or "I can't do anything right" after small errors. In older children and teens, it manifests as procrastination driven by anxiety, refusing to take classes that might lower their GPA, or needing straight A's to feel acceptable as a person. Here's the deeper issue. These children have learned that their value is conditional on performance. Whether intentionally or not, they've received the message that love, approval, and acceptance depend on achievement, good behavior, or being easy children. Their nervous system interprets any failure as a threat to their most fundamental belonging and connection with their caregivers. This often develops when parents, trying to motivate their children, focus heavily on outcomes rather than effort. Comments like, "I'm so proud of your straight A's," or "You're so smart," create conditional worth. So does expressing disappointment in failures. Comparing children to siblings or peers, or having higher emotional availability when children succeed versus when they struggle. So what's the solution? First, explicitly separate your child's worth from their achievements. Say directly, "I love you exactly the same whether you get an A or an F. Your grades tell me about your understanding of math, not about your value as a person." This needs to be said repeatedly until they internalize it, because they've likely internalized the opposite message. Second, shift all your praise from outcomes to effort and strategy. Instead of, "Great job getting an A," say, "I noticed how you studied a little bit each day and asked for help when you were stuck. That approach really worked." Instead of, "You're so smart," say, "You worked through that problem even when it was confusing." That's real learning. Third, celebrate mistakes and failures as learning opportunities. Share your own mistakes openly and model what productive failure looks like. "I totally messed up that presentation at work today. I felt embarrassed, but then I figured out what went wrong so I can do better next time." When your child makes a mistake, respond with curiosity rather than disappointment. "Interesting. What do you think happened there? What could you try differently?" Fourth, reduce the emphasis on achievement and increase the emphasis on character and relationships. Ask about their day, not, "What did you score on the test?" but, "What was something kind you did today? What made you laugh? Who did you help?" This signals that what matters most isn't their performance, but who they are and how they treat others. Fifth, watch your own perfectionism and anxiety about their future. Children absorb parental anxiety. If you're constantly worried about whether they'll get into the right college, make the team, or achieve certain milestones, they feel that pressure and interpret it as conditional love. Work on managing your own achievement anxiety so it doesn't transfer to your children. The third critical sign of childhood insecurity is extreme emotional reactions or behavioral regression. This includes intense meltdowns over minor issues, aggressive behavior that seems out of proportion to the situation, or sudden regression in skills they'd previously mastered, like toileting, sleeping, or emotional regulation. What looks like a behavioral problem is actually an insecurity problem. Secure children can handle disappointment, frustration, and change with developmentally appropriate emotional responses. Insecure children react to small triggers as if they're major threats because their baseline sense of safety is already compromised. Think of it like an alarm system that's too sensitive. It goes off for a spider when it should only trigger for an intruder. Their nervous system is already on high alert, so small stressors create enormous reactions. This might look like the 8-year-old who destroys their room because they can't find their favorite shirt, the 12-year-old who screams at you over being asked to unload the dishwasher, or the 4-year-old who suddenly starts having accidents after being potty trained for a year. It could be the teenager who goes from calm to explosive in seconds, or the toddler who hits other children when they feel overwhelmed. Many parents respond to these behaviors with punishment, consequences, or attempts to teach emotional regulation skills. But here's the problem. These children aren't lacking regulation skills. They're operating from a dysregulated nervous system that perceives threat everywhere. You can't teach skills to a nervous system that's in survival mode. First, you have to reestablish safety. Here's what to do. First, recognize that the behavior is communication. Your child isn't being manipulative, bad, or difficult on purpose. They're telling you in the only way they know how that they don't feel safe and secure. Instead of asking, "How do I stop this behavior?" ask, "What is my child trying to tell me with this behavior?" Usually the answer is, "I need more connection, predictability, or reassurance that I'm safe." Second, stay calm during the storm. When your child is dysregulated, they need your nervous system to help regulate theirs. This is called co-regulation, and it's foundational to childhood security. If you meet their intensity with your own anger, frustration, or anxiety, you're confirming that the world isn't safe and you can't be counted on. Instead, take deep breaths, soften your voice, and project calm even when you don't feel it. Third, address the underlying need, not just the surface behavior. When your son throws a tantrum over the wrong color cup, the issue isn't really the cup. The issue is that his sense of control and predictability has been compromised, possibly by stress, change, or accumulated disconnection with you. After he's calm, offer connection. That was really hard for both of us. Want to sit together for a few minutes? This repairs the relationship and reinforces safety. Fourth, increase preventive connection time. Most behavioral issues in insecure children spike when they haven't had enough quality time with their attachment figures. This isn't about quantity of time or even structured activities. It's about presence. Putting your phone down, making eye contact, playing what they want to play, and showing genuine interest in their world. Even 15 minutes of completely focused attention daily can dramatically reduce behavioral symptoms. Fifth, create predictable routines and give advance warnings about transitions. Insecure children need more structure and predictability than secure children because they're already dealing with internal chaos. Establish consistent daily rhythms for meals, bedtime, and family time. When changes are coming, prepare them in advance. Tomorrow will be different because we have a doctor's appointment. Here's what the day will look like. This external predictability helps calm their internal dysregulation. Sixth, seek to understand what changed. Behavioral regression and emotional dysregulation don't appear randomly. Something has compromised your child's sense of security. Common triggers include parental stress or conflict, new siblings, school changes, friendship problems, loss of important relationships, or even subtle shifts in family dynamics. Identify the stressor and address it directly while rebuilding security. Now that you understand the 3 critical signs of childhood insecurity and the immediate responses for each, let's talk about the bigger picture of rebuilding your child's sense of security. This isn't about quick fixes or parenting techniques you apply for a week. It's about fundamentally shifting your relationship toward consistent emotional safety, and that takes time and sustained effort. The foundation of all security building is what researchers call attunement. This means accurately perceiving your child's emotional state, showing them you understand what they're experiencing, and responding in ways that meet their needs. Secure children have experienced thousands of moments where their parents saw them, understood them, and responded appropriately. Insecure children have experienced too many moments of misattunement, where their needs were missed, misinterpreted, or dismissed. The good news is that you don't need to be perfectly attuned all the time. In fact, research shows that good enough parenting with regular repair is sufficient for security. Dr. Edward Tronick's studies found that parents are only attuned about 30% of the time, but secure attachment develops when parents recognize misattunement and repair it. This means when you miss your child's emotional cues or respond inappropriately, you can fix it by acknowledging the disconnect and reconnecting. This looks like, I realized I was frustrated earlier when you asked me for help and I brushed you off. I'm sorry. Your needs matter and I should have stopped what I was doing to help you. Can we try again? These repairs are incredibly powerful because they teach children that relationships can survive rupture, that they're worthy of apology and repair, and that your love is constant even through conflict or mistakes. Another crucial element is examining your own attachment history. The way you were parented significantly influences how you parent, often unconsciously. If you experienced insecurity in your own childhood, you might unknowingly recreate similar patterns with your children. You might struggle with emotional availability, consistency, or responding appropriately to your child's needs because you never experienced secure attachment yourself. This isn't about blaming yourself or your parents. It's about awareness. If you recognize patterns from your childhood showing up in your parenting, that's valuable information. Consider working with a therapist who specializes in attachment to heal your own wounds so they don't transfer to your children. Many parents find that healing their own childhood insecurity is the most powerful thing they can do for their children's security. If you're committed to breaking generational patterns and raising securely attached children who grow into emotionally healthy adults, make sure to hit that subscribe button and turn on notifications. We share deep, research-based parenting content every week that goes beyond surface behavior management to address the relational foundations that truly matter. Also recognize that different children have different temperaments and needs around security. Some children are naturally more anxious or sensitive and require more reassurance and predictability than others. This doesn't mean you've done something wrong. It means you need to adjust your parenting to match your child's unique needs, rather than expecting them to adapt to a one-size-fits-all approach. Pay attention to what specifically helps your child feel secure. For some children, it's physical touch and closeness. For others, it's quality time and focused attention. Some need words of affirmation and verbal reassurance. Others feel most secure through acts of service when you help them with tasks. Learn your child's specific language of security and speak it fluently. Finally, be patient with the process. If your child has been experiencing insecurity for months or years, it won't resolve in a week of different parenting. Their nervous system has adapted to expect threat and unpredictability, and it will take consistent evidence of safety before they begin to relax and trust. You might see improvements within weeks, but full security building can take months or even years, depending on how long the insecurity has been present and how severe it is. Childhood insecurity isn't a phase to wait out or a behavioral issue to correct. It's a signal. A child who clings, seeks reassurance excessively, melts down over small frustrations, or strives for impossible perfection isn't being difficult. They're trying to tell you that their internal world feels unstable. The foundation of secure attachment isn't built on perfection, but on consistent, attuned care, the kind that says, I see you, I hear you, and you matter. What research in attachment theory makes clear is that insecurity, when left unaddressed, doesn't simply fade with age. It shapes how a child's brain interprets safety, belonging, and self-worth, influencing everything from emotional regulation to adult relationships. The hopeful truth is that insecurity can be repaired. Children are remarkably resilient when parents provide predictable, emotionally safe environments. Small, daily actions, consistent reassurance, physical closeness, emotional attunement, and clear communication build the secure base they need. This is not about spoiling or overprotecting them, but about giving their nervous system the stability it craves to relax, explore, and grow. Repair after misattunement matters even more than getting it right all the time. When parents acknowledge their mistakes and reconnect, they teach children that love is steady and relationships can survive rupture. Equally important is recognizing that your own attachment history plays a role. Parenting from a place of old wounds can unintentionally pass insecurity forward. Awareness and healing, whether through reflection, therapy, or support, can help break that cycle. Every moment of attuned connection, every consistent follow-through, every I love you no matter what, becomes a building block for lifelong resilience. Ultimately, raising secure children isn't about perfect parenting. It's about being reliably present, emotionally available, and willing to repair when things go wrong. When children grow up knowing their worth isn't tied to performance or behavior, but to who they are, they carry that unshakable sense of security into every relationship and challenge they'll face. Insecurity may begin in childhood, but security, when intentionally nurtured, lasts a lifetime.